Welcome to our presentation exploring risk management associated with the Flint, Michigan water crisis. This presentation will review the risk management factors behind the Flint water crisis, starting with general related regulations and incidents and a background of the crisis and the events leading up to it. We will then explore the primary areas of risk management that were improperly addressed throughout the crisis, concluding with the impacts of the unfortunate mistakes. The primary federal regulations regarding drinking water safety in the United States are the Safe Drinking Water Act of 1974 and the Lead and Copper Rule of 1991. Under the federal SDWA, the Environmental Protection Agency sets standards for drinking water quality and oversees all states, localities, and water suppliers that implement these standards. In accordance with the Safe Drinking Water Act, the EPA first issued the Lead and Copper Rule in 1991, following studies that concluded that copper and lead can adversely affect individuals. The LCR was established to limit the levels of these metals in water through the improvement of water treatment centers, measurement of copper and lead levels for customers who use lead plumbing parts, and eliminating water sources as a source of lead and copper. If lead and copper levels exceed established action levels, water suppliers are required to educate their consumers on how to reduce exposure to lead. It's interesting to note that the annual budget of the EPA's Drinking Water Office declined 15% from 2006 to 2015, and the office lost over 10% of its employees between that time. The Association of State Drinking Water Administrators reported in 2013 that 17 states had cut drinking water budgets and 27 had cut spending on full-time employees, causing, quote, serious implications for states' ability to protect public health. The Flint, Michigan water crisis was unfortunately not the first, and certainly not the last, case of harmful lead exposure in United States drinking water. Major related events include the early and mid-2000s lead contamination in Washington, D.C., Columbia, South Carolina, and Durham and Greenville, North Carolina. Following the Flint water crisis, there were issues identified in Mississippi, Ohio, and many other localities, particularly due to increased scrutiny of national lead levels in drinking water. The graphic displayed here helps illustrate the geographic distribution of the roughly 17.6 million Americans served by community water systems with reported violations of the Lead and Copper Rule in 2015. Prior to the Flint water crisis, the state leadership's primary focus was getting the city's finances back on track, which led them to appoint an emergency manager in 2011. Emergency managers in Michigan are appointed by the governor to take control of a local government in times of financial emergency. The appointed officials temporarily displace the existing governing body of the local government and have the authority to remove any elected officials if they refuse to provide information or assistance. Emergency managers have complete control over their appointed localities with the ability to take extreme measures, such as reducing employee pay, outsourcing work, reorganizing departments, and modifying employee contracts. This leadership approach seemed to have great influence on the decisions in Flint, where the primary concern was saving money and the associated risks were sidelined. It's important to note here that 4 separate emergency managers were appointed between 2011 and 2015, each with experience focusing in finance to some degree. From 1967 till April 2014, the City of Flint purchased treated water wholesale from the Detroit Water and Sewage Department, now known as the Great Lakes Water Authority. Throughout this period, the Flint Water Service Center maintained a backup water treatment facility on the Flint River, but the water was known to be polluted and a poor source of drinking water in numerous reports. From 2002 to 2012, the cost per 1,000 cubic feet of treated water from the DWSD nearly tripled. Facing another expected increase in the price of treated water from the DWSD, Flint's emergency manager, with the consent of City Council, decided to join the newly constituted Carrignandi Water Authority in 2013, but the Carrignandi Nandi Water Authority was not proposed to be functional until 2016. By joining the KWA, which was constructing its own pipeline to transmit raw water from the same DWSD source of Lake Huron, Flint officials anticipated savings of $600 million over the next 30 years. In the interim, the city of Flint had the option of continuing to purchase treated water from DWSD or treat Flint water at its own existing facility. After failing to come to an agreement on a short-term contract with DWSD, and in an effort to save an estimated $2 million annually in the meantime, Flint decided on the Flint River water source treated at their existing backup facility. It's interesting to note here that a Flint emergency manager initially rejected this plan 2 years prior, after discussions with the Michigan Department of Environmental Quality. In the spring of 2013, the Flint City Council votes to switch from the DWSD to the KWA, which was due to be completed in 2016. The Flint River would serve as an interim water source. The Flint emergency manager signed the contract in June 2013. On April 25, 2014, the City of Flint's water source was officially switched to the Flint River. Flint's mayor flipped the switch. From the very start, significant risks were being ignored. For one, despite the fact that the Carragnandi pipeline hadn't even been started and the Flint River was going to be the city's primary water source for at least 2 years, the MDEQ did not conduct the 24-month study required by the EPA to calibrate the disinfection system. They believed it wouldn't be necessary, as it was just a temporary switch. Another risk was that the Flint water treatment plant, which had been operating only as a backup water source a few months out of the year for decades, was poorly equipped to handle being a primary water source for a city of that size, and the staff were not properly trained. Perhaps the biggest risk that they took, however, was ignoring the advice and warning of experts. Those risks led to some serious consequences, which in turn resulted in further risk. As a direct result of the lack of proper testing in the unprepared facility, chlorine levels in the drinking water were not reliably measured and the bacteria levels were not well controlled. The state's haste and possibly their desire to cut costs resulted in no corrosion control plan being put in place. The corrosivity of the water, that is, its likelihood of damaging pipes and leaching iron, lead, and other minerals into the water supply, went unmonitored. Just a few months after the project was started, the switch to the Flint River started to cause issues. The summer heat caused an increase in bacteria growth, which is generally to be expected. However, since the plant was ill-prepared, the disinfectant levels were not properly adjusted. Flint saw 2 boil water advisories in the summer of 2014 due to bacteria, the first in mid-August and then again in early September. An outbreak of Legionnaire's disease began due to the poor water quality. 9 deaths have been attributed to this outbreak. To address this problem, the city of Flint took further risks. They added more chlorine into the mix after each incident, and they did not measure the impact of the extra chlorine. Scientists studying the water crisis later on would find that the plant only collected the sufficient data to calculate water corrosivity 6 times in more than 1 year. The increase in chlorine caused an increase in TTHMs, a byproduct of the disinfection process that has been linked to cancer. The increase in chlorine also made the water much more corrosive, though the data collected is sparse. The table shows the corrosivity of the water as calculated using the Larson-Scald index for the 6 days in which the proper data was collected. A Larson-Scald index above 1.2 indicates a high likelihood of corrosivity. As you can see, it's already fairly corrosive about a month after the switch. It gets worse in the summer and then goes down to a lower but still extremely concerning 1.45 in October. In February 2015, after the TTHM problem, the index skyrocketed to 3.40 and remained extremely high. Why did no one raise the alarm? According to researcher Susan Maston, these indices were simply not calculated at the time. In October 2014, the General Motors plant in Flint, their largest water customer, switched water sources because they noticed the water corroding engine parts. In 2015, the issue at hand became lead. Residents, many of whom had been complaining about the color of the water for months, bring bottles of yellow and brown tap water to a city council meeting on January 21st. One of them was Leanne Walters, who is pictured here. Beyond just the color, Walters had noticed her children developing rashes after bathing, her hair falling out, and one of her sons' stunted growth. A city employee tested her tap water for lead on February 26th, and he found concerningly high levels. Her water tested at 104 parts per billion. The federal action level is 15 parts per billion, though many pediatricians now say that there is no safe amount of lead and that any lead exposure at all should be cause for concern. Walters immediately forwards her test results to the regional office of the EPA. The region's regulations manager, Miguel del Toro, then contacted the MDEQ about the issue and inquired about the corrosion control program in place for Flint. The MDEQ blames the plumbing in Walters' house and tells Del Toro that they have the required corrosion control in place. In response to the public unrest about the water situation, the Flint City Council voted to reconnect with Detroit's water system on March 23rd. The emergency manager, however, overruled the vote. Per recommendation from Del Toro at the EPA, Walters sends water samples from her home to Mark Edwards of Virginia Tech. Edwards finds some samples are as high as 13,200 parts per billion. A sample with 5,000 parts per billion is legally considered toxic waste. The MDEQ insists it is a localized issue. On June 24th, Del Toro issues an internal memo to the EPA about the high lead levels in Flint, particularly the fact that the city claimed to have corrosion control in place but clearly didn't. The EPA, however, doesn't want to overstep their bounds and refers the issue to the MDEQ. At this point, most of the damage had already been done, but the state continued to take risks by refusing to acknowledge citizens' concerns, lying about the precautions that they had not taken, and choosing to stay the course instead of trying to minimize the damage. The consequences of the risks taken are fairly obvious. By not taking the issue seriously, citizens were forced to escalate their concerns to federal authorities and then outside experts like Mark Edwards. The state missed a major opportunity by not reconnecting to Detroit Water when the city council voted for it. It wouldn't have made the issue go away, nor would it have fixed the existing problems, but it would have made them look proactive and in touch with the city's needs. Lying about corrosion control was the worst mistake that they made, and it had the most severe consequences in hindsight. On June 25th, Del Toro's memo was leaked to a reporter with the Michigan ACLU, who publishes it. The MDEQ insists that there was no cause for concern and that the report was released by a, quote, rogue employee. On September 3rd, Mark Edwards releases his research showing that multiple homes in Flint had contaminated drinking water with high lead levels. The straw that broke the camel's back was on September 24, 2015, when Dr. Mona Hanna-Attisha, a Flint pediatrician, held a press conference about an increased number of children in Flint with high levels of lead in their blood. Though they initially denied her findings and tried to discredit her, the Michigan Department of Health and Human Services verified Dr. Hanna-Attisha's findings on October 2nd. Arguably the biggest risk of the Flint water crisis was the risk of continuing to deny that anything was wrong. MDEQ spokespeople assured the public that the drinking water was fine, even as independent scientists were finding alarming levels of lead. The state supported their position with flawed studies that purposefully threw out high lead samples and avoided high-risk areas. EPA officials, water pollution specialists, and doctors were indicating that Flint was in serious trouble, but they were all ignored. When Dr. Mona Attisha's study made it clear that lead in the water system was causing serious repercussions to the most vulnerable Flint citizens, and the state themselves confirmed the findings. The state could no longer deny the project's failure. The nationwide outrage pushed the state to take action, resulting in several people at the MDEQ losing their jobs, federal lawsuits, and a major hit to the state and the MDEQ's reputation. The water system was finally switched back to Detroit in October 2015, but the damaged pipes meant that the water wasn't officially drinkable until 2018. In this final section of our presentation, we will first explain effective project risk management and emphasize the importance of proactive planning. We will then move on to discuss some of the decisions made throughout the Flint project lifecycle and explain how proactive risk management would have helped avoid or mitigate the negative impacts of the encountered problems. The objectives of project risk management are to increase the probability and impact of positive events and decrease the probability and impact of adverse events, like threats, to project objectives. In effective risk management, being proactive and not reactive is key in achieving project objectives on time, on budget, and at the desired level of quality. Accordingly, project risk planning needs to begin early and lay the foundation for managing risk for the project ahead. The three categories of risks that projects encounter during their life cycles are controllable known risks, uncontrollable known risks, and unknown risks. The risks that are identified early that get listed in the project risk register are considered known risks. For any known risks, it is possible to proactively plan for responses after adequately analyzing each identified risk by conducting root cause analysis. Root cause analysis makes known project risks more understandable, therefore allowing them to be better managed during project execution. When the root causes are known but out of the project's control, those known but uncontrollable risks should be closely monitored through proactively established trigger points and managed with the activation of predetermined contingency plans if triggered. The third category, unknown risks, are hidden, so specific proactive planning is generally not possible against them until they are encountered. The best method for managing unknown risks involves setting project reserves in the schedule, or budget, or both, based on the measured consequences of unanticipated problems on similar past projects. It is important to note that as part of proactive risk management planning, analyzing past problems to include studying historical data and receiving expert advice can convert unknown risks into known risks, whose negative impacts can be effectively managed during project execution. Unfortunately, in Flint, early risk management planning was not given much emphasis. Therefore, many of the risks fell into the unknown risks category, where they did not necessarily belong. Consequently, after predictable risks fell into the unknown risks category, the project leadership had no other option but to adopt a reactive approach in handling the risks that were unveiling after project kickoff. And because risks were not proactively identified or analyzed adequately, with significant underestimations being made in assessing their probability and potential impact, the project wasn't ready with contingency plans and management reserves. This hindered the project team from adequately responding to and controlling the significant amount of, quote, unknown risks that were being encountered during project execution. This led the project in Flint to get out of control. Next, we are going to highlight some of the key risks that were encountered in Flint during project execution and advise how risk management would have helped mitigate their negative effects. These risks will be categorized under scope, schedule, and resource risks and discussed separately in the following slides. Scope gaps are the result of committing to a project before the project requirements are complete. Then, when legitimate needs are uncovered during project execution, changes are now unavoidable and often uncontrollable. In the case of Flint, the project was kicked off before the research into the quality of the Flint River water was completed. The warning email Mike Glasgow, the water quality supervisor at the Flint water plant, sent to MDEQ, where he mentioned that he doesn't anticipate giving approval to begin sending water out anytime soon, and that if distribution begins, it would be against his direction, should have been a major flag and trigger for the project to closely analyze and plan responses for this known risk of poor water quality. This resulted in taking risk management measures to include establishing trigger points so that this identified risk could be responded to and controlled effectively if encountered during project execution. A major scope dependency risk in Flint was expedited project selection and chartering. On a strategic level, a risk that was identified and assessed was the economic risk. Accordingly, the need for an alternative water supply solution to the current Detroit water supply was determined to be needed for the 2-year interim until the permanent switch to KWA. The problem here was that while the economic risk was identified, the human health risks associated with switching to Flint River water were severely underestimated, and the economic risk was given inappropriate amount of priority over the quality of Flint River water. This imbalance of prioritization continued well into the project, even as problems were being encountered. However, the project leadership continued to not adequately analyze and assess the impact of this scope risk, eventually running the project into failure, going over budget, over schedule, and not maintaining quality. In Flint, adequate risk management planning was not given enough attention prior to project kickoff. As a result, the estimates for the project work were either over-optimistic or unrealistic. Kendrick, 2015, suggests that the portions of the project work that require staff to do things they have never done before are always risky. In the case of Flint, the emergency managers who had financial backgrounds were acting project managers. Accordingly, due to their learning curve coupled with their bias towards prioritizing economic interests, significant schedule misestimations were made prior to project kickoff. One of those misestimations was that the KWA pipeline would be finished on time in just 2 years, whereas it took almost 4 years for it to finally be completed and ready for use by the city of Flint. Slow decisions during project execution were a source of major delays in Flint that resulted in project slippage in terms of schedule, scope, and quality. According to official reports that studied what went wrong in Flint after the fact, EPA's Region 5, which covered Flint, did not implement management controls that could have facilitated more informed and proactive decision-making when Flint and the MDEQ did not properly implement the lead and copper rule. Consequently, while Flint residents were being exposed to lead in their drinking water, the federal response was delayed, in part because the EPA did not establish proactive and clear oversight tools. It is suggested that potential delay risks may be difficult to anticipate, and many of them legitimately appear to be unknown risks. However, in the case of Flint, thorough analysis of the requirements would have revealed these delay risks, as many similar examples of similar incidents were encountered in past projects, as mentioned early in this presentation. The main people risk in Flint was the appointment of the emergency manager as the project manager. Accordingly, the project manager had little focus and no expertise to identify, analyze, and adequately plan for scope and related quality challenges of switching to Flint River water. This situation was a resource risk related to staff ability not only in the project environment, but also on an organizational level. The emergency manager, as the project manager in Flint, was reporting directly to the Department of Treasury on the state level. Therefore, it can be argued that the overall organizational approach of prioritizing the economic risks, like the money risks of the project over scope and quality risks, trickled down the organizational hierarchy, resulting in major scope risks to remain known but inadequately analyzed or unknown until encountered. Besides the project manager, the project staff also proved that they were unprepared to handle this project. When switching to Flint River water, MDEQ staff did not add anti-corrosion chemicals to the water in an effort to save money. Similarly, as reports of problems continued to come in at an increasingly alarming rate, MDEQ staff advised that consumers should boil their water before using it in their homes, which was not a solution to the lead problem. Furthermore, under the MDEQ supervision, the Flint water system did not adhere to lead and copper rule requirements, and the MDEQ did not issue a notice of violation or take any other formal enforcement action regarding these violations until August 2015. Instead, the MDEQ advised Flint Public Water System staff to conduct additional tests and to delay corrosion control treatment installation. This decision to delay corrosion control treatment prolonged Flint residents' exposure to lead. These decisions that were allowed to be made by untrained staff resulted in significant health problems that eventually led the situation to go public as a scandal, catching nationwide attention and coverage. The risks that weren't adequately addressed and managed in Flint had many negative social, economic, and environmental impacts. In April 2016, criminal charges were filed against several Flint water quality supervisory staff, with charges including tampering with evidence and willful neglect of duty. In January 2016, a federal lawsuit was filed in Detroit against the state of Michigan, alleging the state of violating the Safe Drinking Water Act. In January 2017, a $722 million class action lawsuit was filed against the EPA on behalf of more than 1,700 residents who were impacted by the water crisis. Later in 2017, Michigan State Attorney General indicted 15 government officials for their roles in the Flint water crisis. Among them, 12 were state officials, including 2 of the state-appointed emergency managers to Flint. The charges for these individuals ranged from willful neglect and misconduct in office to involuntary manslaughter due to the deaths caused by Legionnaire's disease. Perhaps the most negatively impacted age group in the Flint water crisis was children. To illustrate, United Way estimated in 2016 that 12,000 children in Flint, which made up 43% of the population of children under 18 years old, were exposed to elevated levels of lead over the course of the Flint water crisis. It is estimated that these children will need to be monitored for health effects over the next 20 years because of the Flint water crisis. Accordingly, in 2016, Congress passed $50 million in financial aid to support expanded healthcare programs for the children of Flint, including the Childhood Lead Poisoning Prevention Program and the Healthy Start Program. Furthermore, it is important to note some of the long-term societal effects of Flint due to the children's exposure to lead. Peter Moedig, a professor of public health at Columbia University, calculated that the elevated blood levels found in more than 8,000 Flint children since 2014 will lead to $395 million in social costs based on the likelihood of lower IQ levels for those exposed, leading to lost economic productivity, reliance on welfare, and costs to the criminal justice system. In this final slide of our presentation, we will offer our recommendations towards implementing effective risk management practices in future projects. In 2019, the prosecutions in the Flint water crisis are still ongoing, but continue to be delayed. The outcomes of these lawsuits are crucial and set an example for future similar projects, as these cases have an important impact in the risk tolerance attitudes of future project executives. As of 2019, many official reports have come out as a result of federal and state level investigations that seem to have pinned down exactly where the risk management gaps were in Flint with agonizing precision. Accordingly, these reports have lessons learned information for Flint to include suggestions such as ensuring proper support and expertise for emergency managers and prioritizing health matters across all state agencies with establishment of a new cabinet-level post focused on public health. While these investigations and detailed reports are important, their findings are no use if not integrated into future projects as lesson learned inputs that can be analyzed as a part of preventive risk management planning. In conclusion, it can be said that monitoring water quality against maximum contaminant levels, no matter how stringent, is an inherently reactive approach. Therefore, effective risk management needs to be fundamentally proactive in such projects, especially given the possible negative health impacts as experienced in Flint. Thank you for watching our presentation.